If one puts the same amount of time, the same amount of effort in any other line of endeavor, they will be monetarily much farther ahead than if they're going into medicine. But there's a compensation in medicine that money can't buy. I think the greatest contribution that this organization makes is you people.
I think empathy is critical. It's critical in all aspects of medicine, and to be able to appreciate the trials and tribulations that a patient and a family may be going through is really important, to be able to maintain that level of trust between you and that family.
It's the patient relations and interactions, seeing individuals, improve, especially after sort of being diagnosed, and keeping people able to work and care for their families. It's sort of having that trust, I think, with the provider is tremendously important. And for me, it's professionally very gratifying.
When someone comes in and you see them, oftentimes at the worst point in many of my patients' lives, and we can turn that around and they come back and they go back to life and they're traveling and they share stories with us, it never changes. I mean, that's why we do it. The more that we can do, the happier we all are, and that's the goal every time, and so that's what we strive for.
We take our responsibility in getting the diagnosis as right as we can, really responsibly and thoughtfully, so that way patients don't feel like all is lost on the first day, but that you have a team behind you and that we're going to be with you throughout this.
Some of the best and greatest impacts that neuroscience offers over the coming years is to be able to expand that access and convenience of care across not only the region, not only the nation, but across the globe.
I think that's the greatest challenge, is analyzing or evaluating or sympathizing with patients who are going through these struggles and being realistic while at the same time giving them any option and hope and modern technique that exists to turn that around to some degree.
The fact that MS is so treatable now, a generation ago it really wasn't. There was nothing we could do, but now we've got 17, 18 FDA-approved immunotherapies that slow the disease down, prevent disability, prevent new lesions, and so there's so much we can do.
One of the benefits of our modern healthcare system is that patients are living longer. One of the side effects of that, though, is that our brains weren't designed to live that long. So one of our main challenges is making sure that we have enough community resources at the hospital and elsewhere, so that way people are thinking about it, and then also make sure that patients are really having good care all throughout their life.
If at the end of each day you can look back and say, what have I done today? How have I helped others? How have I improved myself? If I have done this, there is a sense of accomplishment. And this is a tremendous satisfaction.
Our patients come here knowing that they've got a multitude of individuals that are backed with technology, the strength of an institution that's going to be there for them. Everybody is rowing in the same direction to try to help the patients who are right here in front of us every day.